Hi, welcome to the course. My name is Fuad, and this video series will help you understand your reading material, assessment, and health professions education. Now, I'll point out to you in this series what's important, what's not so important. So, let's go right to it. Now, we go on to one of the most, if not the most important part of the discussion about reliability is how to increase reliability. Now, this is the most, for me, the most practical part, and it points out for educators and practitioners, there are three main options to increase the reliability of an assessment. That should be one of our aims, which is to increase the reliability of our assessments. How do we do that? One, adding more test items or raters or stations or other assessment components. Okay, sampling. The more we sample, the more uh, the more reliable the assessment gets. Okay. Second, conducting item analysis and removing, revising, or replacing items that do not work well, which will improve the overall quality of items. What does that mean? We haven't discussed item analysis yet, but if you are familiar with questionnaire construction, you want to make a new questionnaire, you write your items, and you can find out the function, the how your items group together, whether they're functioning or not, and you can delete the items which are not working well. This called the same process can be done in assessment items by using what we call item analysis. We're looking at the difficulty index, the discrimination index, and things like that, and we can delete questions which have low discrimination values, and we will discuss about this in another class, so that our assessment will be composed only of items which are discriminatory. Okay, so that's another way. Increase sampling, do item analysis, and remove poorly performing items. And lastly is combining scores from multiple assessments to form composite scores. That's quite commonly done in many assessments. For example, if you have a long case assessment, those from the medical and nursing and maybe pharmacy will be familiar with long cases, where students are given a case, a live patient, and the candidate goes on to interview this patient and examine, and then an oral viva is done after that, where the students are asked to present what the findings are, and so on and so forth. These examinations are very popular especially in the medical uh, study, and one of its drawbacks is that it requires a lot of time just for one case. Okay, 1.5 hours, 2 hours, that's common. And so if you want to increase the sampling for this kind of assessments, it will be almost impossible, right? So what if you still want to have assessments like this, you still want to have long cases? The answer is to combine the marks. You do not say that a student will pass or fail depending on their performance in the long cases, where they just meet 1 or 2 cases, but you combine the marks with another assessment with more items. For example, you combine the marks with the OSCE marks and then decide based on the 2 assessments. Okay, that's quite common, and that will increase the sampling and therefore increase the reliability, and therefore leads us to make better decisions. Now, Related to this issue of sampling is the concept of content specificity. What content specificity means is that the performance of a candidate on a particular question or particular item or particular case or whatever the assessment might be depends on his or her knowledge for that particular content. And it does not necessarily mean that we can extrapolate the performance in that particular item or that particular case or that particular station to extrapolate that he or she is good in the attribute generally, because performance is found out to be very related to the area, to the content. That's why we call it content specificity. And therefore, if we want to generalize, we have to sample a lot of content. We have to sample a lot of areas. And that gives rise to the concept of sampling. The more you sample, the more accurate will be your decision on the general ability of that attribute which you are measuring. Okay, and okay, so please, it may be well worth your time if you look up content specificity in the literature and read more about that. Now, the discussion goes on, and the author introduces another concept or another formula, the Spearman-Brown formula. This is nice to know, and it is used if you want to know if you have an assessment which produces such and such reliability, then how much or how many items do you need to add to attain such and such reliability. As you can see, this Spearman-Brown formula will become very useful, let's say if in a high stakes assessment, but you are not getting the reliability that you want based on the guidelines we discussed earlier. Remember, let's say you get 0.7, but this is high stakes local exam, you want to reach 0.8, so you wonder how many items do I need to add, and you can use that using the Spearman-Brown formula, and the author gives an illustrative example on how to go about doing it. Now, the last discussion is on composite scores and composite score reliability. Also, when we talked about combining marks just now, it's one of the ways to increase reliability. This part tells us how to calculate the reliability of combined scores. Very useful, especially the implications part. All right. So in summary, right? In summary, this chapter illustrated concepts of reliability and their use in different contexts, the paper-based assessments, as well as the observer-based assessments, and this is based on CTT, classical test theory, and we discussed methods for estimating reliability with examples. We discussed about standard error of measurement. We discussed about the Spearman-Brown formula. Okay, and as we noted earlier in this chapter, reliability is one component of the validity argument. As such, the reliability of an assessment should be taken into context when determining the use and interpretation of assessment scores for making summative decisions.